Hi guys, so today we are just going to go over a few of the top 10 most frequently asked questions with Dr. Stewart. My name is Debbie Walker. I am the manager here at Wabash Valley Children's Dentistry, and we can get right into it. The first question we get a lot of is, when should I schedule my child's first visit?
Yep. American Academy of Pediatric Dentistry recommends that you schedule your first visit 6 months after the eruption of the first teeth. Eruption of the first teeth comes at 1 year. So the easy answer to that is at a year old. At a year, we do what we call lap exams. Lap exams are very easy. Child sits on mom's lap or dad's lap, lays back into my lap. I'll brush their teeth and just do a good generalized quick look at their teeth. There are no x-rays early on. We just do a lap exams and take a quick look. Make sure there's no bottle mouth decay, which is cavities across the front teeth from taking too much bottle at night.
Okay.
So quick exam, very easy, very child friendly. Hopefully getting comfortable, getting used to going to a dental office.
And that is pretty much a synopsis of the first visit, what to anticipate.
Exactly.
Okay.
Yep.
And you mentioned x-rays. Are they safe? Do they hurt? Are they hard to do?
X-rays are important. They're very safe. They're commonly used, and they show cavities that might not be seen in the mouth. Many times there are cavities in between the teeth, and that's what we're looking for with the x-rays. We're also looking for the growth, development of the adult teeth, how much longer those baby teeth have before they're going to fall out, and if there are any cavities or any infections in those baby teeth. So we do commonly take them. We commonly take them after about the age of 3.
So they're safe. Are they painful?
The only thing that's a little bit uncomfortable is putting the film in the mouth. Most kids don't have an issue, but some kids don't like the films in their mouth. Taking the picture does not hurt. Everything's safe and for the most part comfortable.
Great. Okay, so another question we get asked a lot is it bad for my child to use a pacifier?
It's not bad, but what it will do is flare out those front teeth. It'll make those front teeth stick out a little bit more, make the bottom teeth go in. If they're under the age of 1, I think it's common, it's okay, there's no problems with it. At the age of 2, we want to start thinking about weaning them off. They don't have to be off the pacifier at 2, but I'm going to start talking to the parent about weaning them off the pacifier. The way we do that is we usually cut the tip of the pacifier, and it kind of gets them less interested in that pacifier. After the age of 3, if they're still at pacifier, yeah, I'm going to talk to mom about taking the pacifier away. The nice thing is, once the pacifier is away, after a few months, those teeth will kind of go back and come straight again.
Okay, great. So another question we get a lot is, why do we need to take care of the baby teeth if they're going to fall out anyways?
Commonly, cavities start at an early age. Let's say 3, 4 years old, they can get a cavity. These teeth are not going to fall out until about the age of 10, 11 years old. So we cannot leave a cavity in the mouth for 4 or 5 years. If we do that, that cavity is going to get a lot bigger. It's going to grow into the nerve of the tooth and get painful. Then we're going to have to start removing teeth instead of fixing teeth. So we want to see them at an early enough age, catch those cavities early enough so we can get them while they're small and do a minimal amount of removal of the decay instead of a large amount.
Okay. What are some things that parents can do to help prevent tooth decay, whether it's in baby teeth or permanent teeth?
Sure. The most common thing is obviously brush their teeth. Use a fluoride toothpaste. That's going to make the enamel strong and harder. Brush the teeth twice a day for 2 minutes. 2 minutes, everybody. So not just a quick brushing, but going through, really doing round circles around the gum line, keeping those gums clean, and making sure they're getting seen by the dentist twice a year. One thing I'd like to add in is just stay away from the sugary drinks. Stay away from too much candy. If you eat a lot of sugary drinks or eat a lot of candy, make sure you're brushing the teeth afterward. Brush your teeth before you go to bed. Brush your teeth when you wake up.
Do you feel like it's appropriate in parents, and one of the ways they can help their kids prevent tooth decay, that they kind of follow up and help their children brush their teeth to a certain point?
Feel like they should be helping up until about the age of 7, 8, when they can do the manual dexterity of doing those round circles. Otherwise, the parents need to help out. They can always do a little bit on their own, but then parents come in there, help out. Make sure you're brushing along the gum line. Make sure you're brushing those back teeth real well. Get all the way in that back corner. Get on that tongue side and get on the inside. Kids don't brush that area very well because their cheeks are tight or their tongues are in the way. So parents really need to get into those harder areas to get to help their kids brush their teeth. So I'm going to recommend really a parent helps until about the age of 7, 8 years old.
7 or 8. Okay. Is fluoride safe, and should I be using fluoride toothpaste for my child?
There are communities that do not have fluoride in their water, and I've worked in those communities, and it's very obvious that tooth decay is more prevalent where there's not fluoride in your water. So most people in most of the areas do have fluoride in their water. You get fluoride varnish or fluoride foam when you come to the dentist. So by getting it twice a year and by getting it in your water, it is completely safe and highly recommended. If it's not in your water, then I think you should mention it to the dentist, and the dentist obviously will check it out and make sure there is not a rampant amount of decay. But with fluoride in the toothpaste, fluoride in your water, and then even a ACT fluoride mouth rinse is very good to help prevent tooth decay.
Okay. And you said the children should be coming to a dentist how many times a year?
Yep. The easy thing to remember is come to the dentist twice a year, brush your teeth for 2 minutes a day, and check up every 6 months, twice a year.
And what does coming twice a year help do for the
It
kids'
helps us
teeth?
check for cavities, make sure the cavities haven't gotten it very big, make sure nothing's grown and gotten out of proportion. And once a cavity gets into that softer layer of the tooth, it's going to really grow, and it's going to grow quickly. So every 6 months prevents those cavities from getting too big.
Okay. So another question we get a lot has to do with the term sedation dentistry. Can you explain what sedation dentistry is, and if that's something we do here at Wabash Valley Children's Dentistry?
Yeah, there's many different levels of sedation. So we can go through a full sedation where a child is fully asleep. That's usually done in a hospital setting, and I'm going to usually refer out to a different office that will have an anesthesiologist present and actually go through that full asleep dentistry. What we do here at Wabash Valley Children's Dentistry is a nitrous oxide. Nitrous oxide will keep them relaxed. It'll keep them at ease more, not notice things as much. The pain level they won't feel things as much. So we're still going to get them numb. They're still going to be awake, but the nitrous is going to keep them a lot more relaxed. That's what we do here at Wabash Valley, is the nitrous oxide.
Okay. Another question is, do you feel like dental health is just as important as the rest of your body health?
Absolutely. Our teeth can be painful, and if you're not taking care of them, you're going to have pain when you eat. You're going to have pain when you drink cold water. So it's very important to make sure you're getting to the dentist twice a year, getting those teeth checked, making sure there's nothing that's going to cause any pain.
Okay. So those are the 10 most frequently asked questions by parents that we get here at Wabash Valley Children's Dentistry. Thank you for watching.
If any parents have more questions, I'd be happy to sit down, do a private consultation with them, answer questions. Even if you want to just come and meet us first before you bring your child in, I'm always happy to sit down, talk to any parent. Thank you very much.